So, can you just say and spell your name for me and then your title?
Sure, Dr. Dane, Dane, De Silva, DE space Silva. And I am the director of the Division of Population Health Data at the Virginia Department of Health.
Awesome. So, first, start off just giving me a little bit of background information about you and your work with VDH.
Sure. I direct, as I said, the Division of Population Health Data. This is a centralized unit of non-communicable disease epidemiology program areas, and this includes units such as maternal and child health, the cancer registry, environmental public health tracking, chronic disease and our population health surveys. So very largely non-infectious disease side of things.
Awesome. So obviously the big talk is the Scott County cancer cases. I know you all have been doing a lot of different investigations and working with the Virginia Cancer Registry with a lot of that investigation. I just first want to start out with asking, do you all know any history about that area or anything that has happened in the past that could contribute to anything, if it's environmental, if it's not, just anything in that area that you would want to talk about that people should know about?
The first time that we were made aware of this situation was earlier this year in April 2025. Prior to that, we have not heard anything before that, and so our Lenawisco Health District, took the initiative to in, as part of this investigation to provide to the Virginia Cancer Registry. And that was provided to us at the end of July of this year. And at that point, that is when the investigation started.
Gotcha. So you would say the investigation started at the end of July after everything was submitted through the surveys. Is that correct?
Yes, that is correct. Detailed information of all of the cancer concerns and types are needed. And once those are reported to us, we have a certified cancer data analyst on staff that will verify the cases by comparing them to those reported to our cancer registry. And this also includes, verifying diagnosis that Virginians may receive from outside of Virginia, such as Tennessee, especially given the proximity of Scott County to Tennessee. And this just helps us to confirm the diagnoses, the population, and the cancer types to investigate.
Yeah, and I just want to make sure I'm correct. You're investigating 2015 to 2023.
So we are using a 10-year span, so we've expanded from 2014 to 2023, although the survey did request for cases diagnosed starting from 2015.
Okay. And then I just have a question about the cases that were after 2023. Is there a plan for investigating the cases that were in 2024 and even this year for that?
Yeah, so if to as part of our step, we do look at the expected cases, calculate the expected cases based on what we see. And to calculate that expected number, we do need very complete data. And so, our cancer registry data have data from 2023 as the most complete year. And of course, that cancer registry data are behind by 2 years because of the time it takes for reporting, cleaning, and the exchange of data with neighboring states. And this time frame is in line with many other state registries in the country. We recognize that more recent cases, are more difficult to include because of the calculations we perform to look at whether or not there's a significant increase. But we do, of course, reopen and continue to monitor with newer cases once we do have information available.
Okay, cool. So that'll be probably the 2 year data lag. Like, do you think that those cases that are after, once you get more information to actually analyze and investigate, then you'll also do those cases in the most recent years?
Yes, that's right. So, investigations into a specific area may always be reopened in the future with the addition of new full year data.
Okay. And in the investigation right now, I know, can you just talk about what you are currently looking at? I know there's been talk about an environmental link, no environmental link. I know VDH has come out saying there's no environmental link right now. But for people out there that are concerned parents, Do you have anything that you can share about your investigation right now before it's closed? Any other information of what could be a causer?
So to when we look at the potential cluster, again, we're using CDC guidelines to examine those cases. And so the first step that really we do is to calculate that expected number of the reported cancer types compared with the rest of Virginia to determine if there is a significant increase of cancer incidence rate in the county. And then should the data continue to point to a strong potential for a cancer cluster or unusual pattern, the next step would be to launch an even more in-depth investigation to determine what factors may be contributing to an increase in cancer cases. And depending on the nature of this pattern, this step could involve several activities, including assistance from the CDC to help us assess if the increase in cancer is associated with certain environmental factors. It could also be consulting with the Agency for Toxic Substances and Disease Registry to understand if there are any harmful environmental exposures that may be going on in the community. And it
Okay.
could also include a more in-depth epidemiological study to look at those exposures and outcome. We are aware that the community has raised some environmental concerns, and so a summary of those concerns received, along with some background information and resources, will be included in a report that we anticipate to have by the end of the year.
Okay. End of the year. So that'll be in a couple weeks, right? That people can
Yeah.
expect that first report. So in that investigation, that first part, you're doing the analyzing right now, but you're saying that it could possibly be even taken to a next level of investigation, which would have you all require more of in-depth research and on-site testing for environmental factors.
So, should the data point to a strong potential cancer cluster or unusual pattern, then a next step would be to launch an even more in-depth investigation. And again, that could include identifying whether there are whether it's associated with certain environmental factors.
Okay. Any comment on the independent testing of the water that's going on right now that families are doing?
Unfortunately, we don't have any more information on that. We will be including information on environmental concerns in the summary received. We do know that our public drinking water testing is available on our VDH website publicly.
Okay. And anything you want to say to families and, kids in Scott County that are concerned and that are dealing with some hard times? Anything that VDH wants to say to them and through their journey of this?
Yeah, we know that many families in the community have been deeply affected by childhood cancer. We can only imagine how hard it is to navigate through this, and we want to know that their voices, experiences, and questions do matter to us. And we are committed to transparency, accuracy, and compassion as this work continues. Our main goal really is to ensure that the investigation is thorough, complete, and reliable. And we'll continue to share more updates as we learn more. But we do encourage the community and families to reach out with questions, concerns, and to report any new diagnoses to Lenawisco Health District.
Okay. Is there anything I might have missed about the investigation that you want to cover? Anything about the water system in Scott County that you want to comment on? I don't know if there's anything that you would be able to talk about with that.
At this time, really the summary of environmental concerns will be included in our report, and so we would like to wait until that report is released. And there is an email address as well where Scott County residents could reach out with questions here.
Okay, cool. Anything else that I might have missed that you want to highlight?
I don't think so. Yeah, this is a complex process, and we definitely understand the nature and how hard it's been for the community.
Yeah. And I know you already confirmed this with me. I just want to confirm again. You really didn't start getting complaints about this until April of this year, right?
Yes, that's
Is
correct.
when you started kind of hearing about it, and then the survey became available, and then that needed to be submitted by end of July.
That's correct. Yes.
Okay. Okay, cool. And then lastly, any history about the county that I know you probably can't say much about the investigation. You're going to have more in the report, but anything about that history that you can share that you're looking into in the county at all that people should know about?
So, we know that the community has raised environmental concerns related to a variety of factors, and, we will include a summary of those concerns and the background and resources in that
Okay.
report.